Hello everyone, I am Urologist Ömür Erdem Akkaya. Today we are going to make a short video about the drug Metoprolol, or Balak as it is most commonly known in the world, which is widely prescribed for high blood pressure, palpitations, or after a heart attack, and its relationship with erectile dysfunction. Does Balak or Metoprolol cause erectile dysfunction? Yes, it does. We see that it causes erectile dysfunction in some patients. Balak is one of the most prescribed medications in cardiology clinics. As I said, it is one of the most prescribed medications for palpitations, blood pressure and after heart attacks. So how do patients come to us? Patients may come to us with a complaint of erectile dysfunction after using this medication for a few months. When we question the patient's history, we see that he has used this medication. So what do we do in this case? After a cardiology consultation, we either tell the patient to stop this medication or to change it. If there is a necessity to use it, we try to overcome the erectile dysfunction problem by giving other treatments. Currently, it should be taken into account that 1 out of every 2 men who reach the age of 50 begins to have problems with erectile dysfunction. Apart from that, if the patient has high blood pressure and is also using one of the metoprolol group drugs called beta blockers, the possibility of developing erectile dysfunction increases to 70%. This will sound like a very exaggerated rate, but 70% is not an exaggerated rate. Already 50% of men over the age of 50 have erectile dysfunction or more or less complaints about sexuality. At the same time, this drug called metoprolol is very famous in social media and on the internet. When you search for this medication on the internet and read about the side effect of erectile dysfunction, you can immediately be under the influence of this. On the one hand, he also calls erectile dysfunction to himself, thinking, I may have erectile dysfunction. Because studies have also been done on this subject. Patients were told, we will give you metoprolol, but it may cause erectile dysfunction, let's see what happens. Erectile dysfunction developed in 30% of the patients. The other group was told, we will give you medicine for your disease, use it and see how you will be. They showed that 8 to 10% of the patients in this group also developed erectile dysfunction. This is called the nocebo effect. When you tell the patient that such a side effect may occur, the rate of this side effect increases. But in conclusion, if you are taking a medication containing the active ingredient metoprolol and you develop erectile dysfunction, you should definitely talk to the doctor who prescribed that medication. Thank you for listening. Best regards.